Dr. Ovadia, welcome to the show.
Great to be here with you. Excited to talk with you and your audience.
Yeah, thank you so much for joining me, man. I know kind of starting now. It's we're pretty early into the podcast right now, but this is a topic that is your area of expertise. Is a topic that's near and dear to me. I've undergone a very similar transformation as yourself, and I'm very interested in this information. I know a bunch of my audiences as well. So for those of my audience who live under a rock and may not know who you are, could you please introduce yourself and tell them what you do?
Yeah, definitely. I have been a heart surgeon now for over 20 years. I've done over 3,000 heart surgeries. And during much of that time, I was a very unhealthy heart surgeon. I had reached a point about 10 years ago that I was morbidly obese. I was pre-diabetic, and I realized that I was going to end up on my own operating table, so to speak. And I also realized that I didn't know what to do about it. I had been, trained to give advice to patients on, how to avoid heart disease, how to stay healthy. It's the advice that we've all heard, eat a low-fat diet, count your calories, get more exercise, follow the food pyramid. And that advice wasn't working for me. And obviously, it wasn't working for my patients. They were ending up on my operating table. So I started to think about things a little different, started to ask some different questions, started to then come across some different information. And ultimately, I was able to first heal myself, lost around 100 pounds, reversed my prediabetes, been able to maintain that weight loss, importantly, something I hadn't been able to do before. And along the way, I started realizing that what I thought I knew, what I thought we knew about heart disease, was maybe not the full story or the correct story. And that has led me down this path now for the past 8 or 9 years. I've been on this mission to keep people off my operating table, wrote my book, Stay Off My Operating Table, a few years ago now, and now continue to operate, but also have a active telemedicine practice that I work with people on how not to need surgery.
Fantastic, fantastic, man, and congratulations on that. That's really admirable to get it off and keep it off. I'm hoping I get to keep mine off. So far, I'm down about 72 pounds.
Awesome.
Continuing to lose, and some of the advice that I've received from you peripherally on your podcast and various appearances, as well as the community at large, has really helped me out. When I started out, I didn't know a lot about metabolic health. So maybe we start there. Tell us what metabolic health is. For a normie, for somebody who might be a layperson. What you hear people talk about metabolic health? What do you mean when you say that, and why is it so critical to preventing heart disease?
Yeah, so the simple way that I explain it is metabolic health is your body's ability to properly utilize the inputs that you're giving it. And the main input we give our body is the food that we eat. When we are metabolically healthy, right, one of three things happens to that food. And when we're healthy, it all gets balanced correctly, right? So when we eat, some of that food gets immediately turned into energy and goes into fueling, all of the activities within our body throughout the day. Some of that food gets broken down into its kind of components, and it's used to build and rebuild our tissues, another process that's constantly going on within ourselves. And then some of that gets turned into energy and put into storage for times when we're not eating. Historically, right, when food wouldn't be available. But even, when we just don't, when we're sleeping, for instance, and we're not eating. And the problem when we become metabolically unhealthy is that balance is lost. And usually what ends up happening is too much gets stored as energy, and we don't get the opportunity to use that energy. It just kind of gets stuck in permanent storage, and it then causes a whole host of downstream problems, uh, heart disease being one of them. But it turns out that metabolic health is the root cause, is the underpinning reason behind almost all of the chronic diseases that we face. So, not only heart disease, cancer, diabetes, Alzheimer's disease. You can keep going down and down the list. One thing that's I oftentimes highlight that's surprising to people is our mental health is related to our metabolic health. So as we're looking at the chronic problems that plague society today, mental health is becoming a big one, and it itself is rooted in metabolic health.
How so? Specifically, what do you mean?
Yeah, so we are now discovering that many of these mental health disorders, things like schizophrenia, bipolar, more common things like depression, are related to poor metabolic health. Insulin resistance is sort of the biochemical term for metabolic health. And we discover that people that have these diagnoses have higher incidence of insulin resistance. That's one level of evidence. More importantly, we now know that when you address the insulin resistance, the mental health gets better. And so I have countless people at this point telling me, and they come to me for heart disease, and they have insulin resistance, and we address that, and they're like, oh, by the way, I got off my medications for depression. My mental health is just better. Even people that don't have the formal diagnoses and maybe weren't on medications. I mean, this is something I noticed within myself. My mood just stabilized. I don't have those ups and downs that I used to have. And I think many people experience the same when they address their metabolic health.
Got it. Got it. It totally makes sense, and I've heard anecdotes around that. I wasn't sure that it was a fully fleshed out hypothesis, so that's interesting to know. But I have heard, dementia and Alzheimer's be referred to as type 3 diabetes. Is that sort of commonly accepted now? Do we all in the medical community sort of accept that that's a fact?
Yeah, I would say it's probably not quite mainstream yet, but I think it is fairly well accepted. And again, we have many levels of evidence here. We can actually see the inflammation within the brain, right? And inflammation is one of the hallmarks of poor metabolic health. We get inflammation in the blood vessels that leads to the cardiovascular disease. And we're now recognizing we get inflammation in the brain that leads to these mental health issues, as well as things like dementia, Alzheimer's disease, and even other neurologic conditions like Parkinson's disease, for instance. All are showing evidence that insulin resistance and inflammation play a big role in these.
Got it. Got it. And so managing inflammation is probably fairly important for your overall health, right? And looking at inflammatory markers and that sort of thing. Do you test that with your patients and have them, get some blood work done? How do you approach inflammation?
Yes, definitely so. It's one of the things we routinely check, and we then follow up on. We check it on intermittent basis. Most of my patients get labs done 3 to 4 times a year, and inflammation is one of those markers that we're trending and seeing, what direction it's moving in and what level it's at.
Got it. And so, not to be too wonky, but what are you measuring? Is it C-reactive protein, or is it TNF alpha or IL-6, or what are we actually measuring when we're getting the labs?
Yeah, so for me, C-reactive protein is the big sort of general inflammation marker in the body. Then there are other inflammation related markers we're looking at, things like ferritin, for instance, things like homocysteine, which is important when it comes to cardiovascular health. And then, because we are focused on cardiovascular disease, I go deeper and look at some blood vessel specific inflammation markers. And these are things like myeloperoxidase, it's called MPO. And then there's another one, LPPLA2, getting very wonky now. and that those are both markers that are specific to the blood vessel, and may give us some indications about whether there's active ongoing blood vessel damage and plaque formation happening.
Got it. Got it. And that totally makes sense. And I know what you're talking about. I'm a big nerd on this stuff, so it totally makes sense to me.
Yeah.
For let's talk about maybe a mechanism, right? So these are signs that your blood vessels are being compromised and you're at risk, right? Talk to me about the mechanism that causes heart disease in the first place.
Yeah, so this is something that I think is largely misunderstood even by the doctors. And the concept has always been, right, that it's a cholesterol problem. And
Mm.
having high cholesterol leads to plaque, right? These plaques are largely made of cholesterol, and therefore it kind of makes sense. You have a lot of cholesterol in your blood, and a lot of cholesterol ends up in the blood vessel wall. However, there's some problems with that theory. And the first one is that in order for cholesterol to cross from the bloodstream to the blood vessel wall, where the plaque is actually building up, you need damage to the blood vessel wall. And so that's, again, what initiates this process is damage to the blood vessel wall. And then you can step back and say, okay, what causes the damage to the blood vessel wall? And this is things like having a high blood sugar level can lead to that. Toxins such as smoking, right? What's in cigarette smoke is going to be directly toxic and damaging to the blood vessel wall. And it turns out that insulin resistance, in and of itself, having high levels of insulin in the bloodstream can be damaging to the blood vessel wall. And the reason that can occur outside of the blood sugar issue is that insulin, when it is high, it lowers production of what's called nitric oxide.
Mm.
Nitric oxide is a very important chemical that helps to protect our blood vessels, helps them to be kind of more relaxed, and helps protect the lining of the blood vessels, what's called the endothelium. So we actually have a direct mechanism between this high insulin resistance we're talking about, and the blood vessel damage that we then see in heart disease.
Got it. And that's what we're talking about is what we some people might have heard the term disrupted endothelium, right? Like that's really what we're talking about that initiates the entire process. Could you talk to me about like what the endothelium actually is? I think people have a very poor understanding generally of like what is this thing?
Yeah, so our blood vessels, the walls of our blood vessels, right? These are tubes, and the wall of the blood vessel has a number of layers to it. And that innermost layer that actually interfaces with the blood that is moving through the blood vessel is the endothelium. And it is basically a lining. In most cases, it's actually just one cell layer thick, but it is incredibly complex. There are all sorts of, chemical reactions that are going on there, right? We have these things called, for instance, cytokines and chemokines, and they're being excreted from the blood vessel wall through the endothelium, and they are modulating, right, how the things that are in the blood, things like cholesterol, for instance, these cholesterol carrying particles in the blood, are interacting with the blood vessel wall. And so the endothelium is very important. And, the endothelium is also a barrier that prevents the stuff that's in the bloodstream from getting into the blood vessel wall for the most part. There's selective transport across the endothelium for some things that we want to get across. And then it's a barrier for the things that we don't want to normally get across. But again, when that gets damaged, now things that we don't normally want to get across can get across. And then once they're in the blood vessel wall, they can cause problems there. For instance, when we're talking about LDL particles, and specifically when we're talking about a subtype of them called small dense LDL particles, When they get into the blood vessel wall, they cause problems. They set off an inflammatory response, and that's what can then lead to this plaque formation.
Got it, got it. And that's well, typically, you'll see a soft plaque form first, right? And then over time, that just calcifies, and that's what shows up in the CAC score, correct?
Well, and again, that concept of the stages of plaque, and we go from soft plaque to calcified plaque, isn't entirely demonstrated either. It's
Mm,
clear that there are different types of plaque, right? There's this calcified, non-calcified plaque. We have these earlier things, for instance, called fatty streaks. But the fact that it might be a linear progression between those stages is actually not as well proven as we think it is when you hear people talk about this. But it's a useful distinction, at least, that there are these different types of plaque that might have different implications as to the risk of disease ultimately.
got it. That totally makes sense. And I've heard conflicting information about this, so I'd love to get your opinion around management. Right? Let's say that you've had a CT angiogram or you've had a CAC done, and you've got some, you got some damage. You got some progression. Is there anything you can do to sort of roll this thing back? I think that's what people are concerned with. And I've
Yeah.
heard say, like, if you do a lot of D3 and K2, it stops the calcium from forming in the tissues, and it pulls it into the bones and the teeth. And I don't know how much truth there is to that. Like, do you have any understanding around that?
Yeah, this is something we work on every day in my practice. And so the first concept I think that's important to understand is you got to stop doing the damage, right? You got
Mm,
to identify what's causing the damage to the blood vessels and stop that. And again, in the vast majority of cases, insulin resistance is what is starting this cascade. We, of course, have other factors we have to think about, right? If someone's smoking, it's obvious, stop smoking. But if someone has insulin resistance, we have to first reverse the insulin resistance. And the best way to do that is with dietary and lifestyle interventions. Low carbohydrate, what we call therapeutic carbohydrate restriction, is the first step there. Once you stop doing the damage, there may be other things that can help. You mentioned things like supplements. So vitamin K2 does seem to be important in this process. Vitamin K2, important to point out, only comes from animal products. It does not exist in the plant kingdom. There's a different form of vitamin K in the plant kingdom, vitamin K1, that doesn't do the same things. Vitamin K2, it is a signaling molecule that helps our body to regulate the calcium distribution. So, higher levels of vitamin K2 will promote the calcium going into and staying in the bones, and therefore less of it's going to end up in the circulation and ultimately in the blood vessels. Um, Perhaps a more important supplement when we're talking about this is something called nattokinase.
mhm.
Nattokinase is a natural blood thinner. It helps to break down blood clots when they're starting to form, and so therefore it prevents them from getting to the mature stages. And nattokinase has been shown in clinical trials to reduce plaque in the blood vessels. Now, a caveat about that, they looked at plaque in the carotid arteries in the neck, may not be directly correlated to the coronary arteries, but good enough reason to believe that there is correlation. And so nattokinase, for instance, is a supplement that I recommend. But supplements are supplements, right? They are supplementary, and we got to focus on the important things first. And your diet and your associated habits are those most important things. And we have to focus first and foremost on where do you stand in regards to insulin resistance? What do we need to do to reverse that if it's not, if you are insulin resistant, if your metabolic health is not optimal? And then, more and more, it's also about the inflammation. And if you have inflammation, that's damaging to the blood vessels. where is that inflammation coming from, and what can we do to address that part of it as well.
Got it. So before I really am going to take a hard pivot to diet. I promise in 1 second. But
Yep,
I do
no
have a
worries.
question about high blood pressure, right?
Yeah.
Because my and just correct me if I'm wrong. My understanding is one of the dangers of high blood pressure is just that the mechanical pressure of those arteries, with the cholesterol and the insulin resistance combined, sort of helps push that cholesterol through the endothelium and sort of lodge it into the cell wall. Is that, or into the vessel wall? Is that true, or am I just full of it?
Yeah, not quite true. So the mechanical damage to the blood vessel wall will start to break down that endothelial barrier, and this then allows the cholesterol to pass through. It's not that the blood
Mm,
pressure is actually pushing the cholesterol through the endothelium. Blood pressure, high blood pressure, is a major risk factor for heart disease. And again, there might be two things going on here. Number one is, like I said, the mechanical pressure, that increased mechanical pressure breaks down the endothelium and can lead to heart disease that way. But high blood pressure is also commonly related to insulin resistance. High blood pressure is actually one of the markers we use to evaluate someone's metabolic health. And so the insulin resistance that's underpinning the high blood pressure may be as much of a contributor, if not more, than the actual mechanical, effects of the high blood pressure.
got it. Got it. That totally makes sense. The reason I brought that up is somebody had stated that you don't see the similar type of plaquing in the venous system because it's not under the same type of mechanical pressure. And so that's what the core of my query there.
Yeah, and there's a couple of different, differences between the veins and the arteries, why we don't see this atherosclerotic plaque. And you're right, the pressure is different in the veins and the arteries, but it's not the only reason, right? It's not the only difference between them, and like I said, it is not a matter of the high blood pressure pushing this stuff through the wall. It's the damage that the blood pressure does to the wall of the blood vessel that then allows this stuff to cross that endothelium.
Got it. Totally makes sense. Thanks for clearing that up. So now let's poke at a controversial topic: diet. Right? I was helped immensely, and I really started my fitness journey, my health journey, around Carnivore January last year, not this year, but previous year.
Yep.
And there seems to be a lot of controversy around this. You have the Lane Nortons of the world, are saying that the cholesterol is going to kill everybody, and it's unhealthy, and it's this extreme diet, and I hear all of this talk, but in my case, like the first month, I dropped like 27 pounds, and my blood pressure went from borderline hypertension to low normal. Like I did that in a month. And so
Yep.
for me, like I didn't experience any negative health outcomes, and I'm now in sort of quote unquote the community, although I'm not completely carnivore. But I just wanted to get a professional's take. Like, what do you think about the carnivore diet?
I think the carnivore diet is our default diet as human beings. And what I view as the extreme diet is the standard American diet. That is extreme. And we look at the transition that has happened over the past 70 years to that diet, and we see the outcomes of it. Red meat is not harmful for our health. And I will challenge anyone to, prove me wrong on that. The evidence for it being harmful for our health simply does not exist. It is poor quality, evidence that is then manipulated and turned into a story. But we have been eating red meat our entire existence as human beings, and there is just no way to fathom that for the first million years we were eating it, right? Up until 100 years ago, it wasn't harmful. And then somehow 100 years ago, it all of a sudden became harmful to our health. It just simply does not make sense. And like I said, the science is not there to support it. And the critical scientific reviews of this topic and there have been multiple ones of them that have come out over the past few years, have all shown that red meat in and of itself is not harmful to our health. The problem is most people don't eat red meat in isolation. They don't eat a carnivore diet. They eat red meat in the context of a standard American diet. And yes, there is harm from the standard American diet. But again, it's not coming from the red meat. It's coming from what we're eating from the red meat. So the first thing I want people to understand is carnivore is a healthy diet option. I don't think it's the only healthy diet option. I don't think everyone needs to be on a carnivore diet, but I want people to understand that it is an option. It is not damaging your heart health or damaging your health in any other way.
Excellent. That's my read of the literature as well. But every once in a while, you get somebody that throws a wrench in the works, and I start to think, like maybe they're onto something. So, what would you say to somebody like Lane Norton, who was very vocal about the Mendelian randomization with the folks that have that genetic predisposition to produce higher cholesterol levels, and you can draw a line straight through it, with respect to correlation between overall lifetime cholesterol exposure and heart disease outcomes. What do you say to Lane?
Yeah, so the first thing I say to Lane is Mendelian randomization is junk science. It is fancy statistical manipulation. It tells us nothing about our health. And even if you accept it, right, correlation is not causation. And so cholesterol in and of itself is not the cause of heart disease. Cholesterol is associated with heart disease because specific subtypes of cholesterol carrying particles are can be problematic. Like I said earlier, when they get into the blood vessel wall, the small dense LDL particles, the VLDL particles, these are damaged particles that then set off an inflammatory reaction. However, that does not mean that all cholesterol is harmful. And this concept that the way that we prevent heart disease is by lowering people's cholesterol is a failed experiment. And that this is something else I point to. We have been pushing this narrative for the past 70 years, right? Cholesterol lowering medications have been among, if not the most widely prescribed medications for the past 40 years. Our cholesterol levels as a society are lower than they've ever been, and heart disease is not going away. I tell the story that when I was deciding what surgical specialty to pursue, as I was finishing up my training in the early 2000s, right? And I was talking to my mentors and I said, I want to go into heart surgery. And they said, you would be an idiot to go into heart surgery. There is going to be nothing for you to do in 20 years. We've figured out heart disease. We have cholesterol lowering medications, and heart disease is going to be a dying, pursuit. Well, here we are, 20 plus years later. I am busier than ever as a heart surgeon. Heart disease is still far and away the number one killer in the United States and worldwide. And it is clear that lowering cholesterol is not the way that we are going to solve heart disease. The way that we solve heart disease is, again, what we've been talking about throughout this program. Stop doing the damage to your blood vessels. Reverse the insulin resistance, reverse the inflammation. And when you do that, cholesterol is not a problematic substance in our body and is actually the beneficial substance that it is. Cholesterol allows us to live. We die without cholesterol. Cholesterol is part of our immune system. It helps us to fight infection and cancer. Cholesterol is a precursor for the essential hormones in our body. Things like testosterone, estrogen, progesterone, things like vitamin D. These are all made from cholesterol. So this concept that, lowering your cholesterol is the way to solve heart disease is simply a failed concept. And you can point to all of these, statistically manipulated studies that somehow line up cholesterol and heart disease. And I'm just going to point to the evidence in front of me, which is, the majority of people that end up on my operating table have been taking cholesterol lowering medications. the majority of people that come into a hospital with a heart attack do not have elevated cholesterol levels. And we need to acknowledge this, and we need to stop, repeating the same failed concept that we just need to lower people's cholesterol, and anything that might raise your cholesterol, like eating red meat, is problematic.
Yeah, yeah, that's fair. What I would say though is the average patient or the average person who might encounter a doctor, a GP, or a cardiologist, they're going to get some contrary information, right? Like this is very very widespread. It's very much in the mainstream. What are they to do when they're confronted with a doctor that might be pushing a statin on them from the jump, or give them a completely counter nutrition and health advice to what you would give? Like what's your advice for those people?
Yeah, that's the problem, right? And my advice to those people is to ask questions of their doctors. What is the evidence? How much is taking this medication going to lower my risk of disease, right? And don't, when they tell you, oh, it's going to be a 40 or 50% reduction, you ask them, is that an absolute risk reduction or is that a relative risk reduction? Things like, what is the number needed to treat? Just be more curious, right? And ask these questions. And it's not a matter of fighting with your doctor. It's just a matter of, if they, my role as a doctor is to educate you so you can make the choices that are going to be best for your health. When you're told things like a medication is the only way to solve your problem, that should prompt you to ask questions. Like, why would a medication that didn't exist before 40 years ago be the only answer to my problem when this hasn't been a problem, throughout the majority of human existence? Those are the types of questions we need to be asking of our doctors, quite frankly, to get your doctor to think about that. Because your doctor, if they're giving you the standard advice, they're not thinking about it. They're just repeating what they've been told. And I understand this well. I did this. I was in that world, and I was a run of the mill, well educated, but very closed minded heart surgeon. And it was only when I started to recognize how it was failing me, how it was failing my patients, and started asking these different questions, that I've now been able to truly help people improve their health. As a heart surgeon, right, I was continuing to put band-aids on the problem. And understand, it is very important work, right? I feel blessed every day as a heart surgeon when I have someone who is literally at death's door, and I can do this surgery, and I can improve their life, and I can extend their life. But I now acknowledge I haven't actually fixed their problem. I put a band-aid on it, I gave them more time, and my role as a doctor is now to help them understand what their problem actually is and how they can fix it. I've given them the second opportunity to fix it. And more, I'm hoping people, come to this before they need the heart surgery so they don't need that second opportunity from me.
Yeah, and that's a paradigm I think really needs to shift, and this is one of the aims of this podcast, is to put accurate information out that is maybe counter to the official narrative, because I think people are skeptical of our institutions. I think our institutions have obviously failed us. They've been captured by corporate interests, the drug companies, big pharma. They push these narratives, and they sort of guide policy. They set standards of care. They tilt the scales in their favor, and it's not with respect to patient care. It's with respect to profit, oftentimes, right? So I think there's some growing skepticism and some more open-mindedness around some counter narratives and some heterodox views of things. And I love seeing it, right? But ultimately, you guys tend to get turned into pariahs. You are going off on your own, and you're dangerous. You're spreading misinformation. It's like you see this over and over again. And there's this appeal to authority that I see that I really want to push back on, which is there's almost memeified at this point. It's like, well, your Google search or your private investigation doesn't trump my medical degree. Have you heard that stuff? Like
Oh, yeah. Yep.
it's so patronizing. Like relatively intelligent human beings aren't able to listen to a variety of opinions from experts and educate themselves and have conversations like you and I are having to sort of and maybe even do some N of one experimentation upon themselves, right? Like I think that movement is growing a little bit, but that whole thing really frustrates me, and I really wish that we could push back, but it feels like there are some entrenched interests that this is completely, cutting into their profit margins and harming their bottom line.
Yeah, and understand that, your doctor is trapped within that system as well. The medical education system is one that very much discourages independent thought these days, right? And that should be scary to everyone that's hearing this, right? Because, if our doctors can't think independently, that is a very problematic situation. And, we as doctors should be obligated, to ask these questions on behalf of our patients, right? Why are there so many sick patients? Why are there so many people that need heart surgery? We think we acknowledge, and it's widely talked about these days, right, that there's a shortage of doctors. In my field, heart surgery, it's an acute problem. There is literally not enough heart surgeons in this country to do the number of heart surgeries that need to be done. And the traditional view of this problem is, okay, well, what do we do to make more doctors, or what kind of technologies can we leverage to make doctors more efficient, right? Those types of questions get asked, and no one steps back and says, why are there so many sick patients? And that's really the number one question that we should be asking. And I'm optimistic to see that it's actually starting to get asked, right? We have a new administration, and they are actually starting to ask those questions. Why are there so many sick people? What can we do about this chronic disease epidemic that we're in the midst of?
Yeah, and I don't think that they've got the answer, honestly. Like, I think it's a great question to ask, but I keep going back to this, which is an answer that people don't want to hear, which is you're in charge of your own health.
Yeah.
Healthcare is not going to the doctor. Healthcare is not getting a stent put in. It's not getting on medication. It is not seeing your doctor for your visits, right? Like that's a component of healthcare for sure. But ultimately, most of your healthcare should be your lifestyle things, your exercise regimen, your mental health. Are you meditating? Are you using the sauna? Are you exercising? Are you eating a whole foods diet? With adequate macros and proteins and stuff like that's healthcare, and people are conflated that with the medical complex, right? Like being involved somehow in a medical transaction with a doctor or professional, and it's very frustrating to try to sort of flip that paradigm on its head.
Yeah, it's not going to be an easy task, but like I said, the power lies within each of us, right? This is
Mm.
a central part of my message. Like you said, people need to take back control of their health. You should not be relying on your doctor to make you healthy, right? As I said earlier, the doctor's role is to educate you. And, the way that I view my role in my practice with my patients is I educate them on what it takes to be healthy, and it's up to them to put it into action. When I talk about the carnivore diet, for instance, I always say it's a simple concept, but it's not easy to implement. And that's the challenge. But that's where it comes back to each one of us to figure out what we need, right? And a lot of this comes to mindset, what we need to be able to implement this. One of the questions I'm always asking my patients is why? Why do you want to be healthy, right? And you got to really understand that, because when you're, at the restaurant choosing between, the carnivore low carb option, right, and the standard option that everyone else is choosing, the only thing that's really going to keep you on the path, the correct path, the one that you want to follow, is understanding why you're doing this. And when your friend says, "Oh, well, go ahead and enjoy the whatever it is," right? You have to have the reason why that's not serving your goals. And that why is more important to you than, in the moment having whatever the treat might be.
Yeah, and that's a difficult one because we're not living in silos, right? We're a tribal species. We're a social creature, and I've dealt with this. You know, my family's not carnivore. They're not low carb. They kind of do not a standard American diet, but they deviate quite a bit from what I do, and that presents issues with not only meal planning, and then you have to have like a two meal type of situation, and then when you go out to eat, like you said, sometimes there's not great options. So you have to plan ahead. Maybe I do some dehydration of meat, so I've got like a jerky type of thing I'll make with some chuck steak or something, and have that on hand. Like you kind of have to plan a lot more, but you said it was like not simple to implement, but I kind of disagree. If it was just me by myself, like it's very simple. I have a very short shopping list. I've got I'm a huge proponent of chuck. I think it's one of the best meats out there. I chuck steaks all the time. I'll have ground chuck. I'll have just really simple eggs. You know, all the basics, right? And I'm typically one meal a day. Like I eat until I'm full, and then I'm so like if you ask me at dinner time if I'm hungry, I'm just like, oh, I'm still full from breakfast. I'm very satiated. So for me, like the amount of time and effort and energy I spend thinking about meals, shopping for meals, preparing meals, cleaning dishes, like it has simplified my life a lot actually compared to the way I used to eat.
Yeah, and honestly, that's one of the big attractions for me as well, right? Having a complicated, busy life that I do. You're right. Carnivore is, like I said, it's simple, not easy, right, to do in our environment. But you're right, it's very simple, and that's one of the big appeals for myself and many other people I talk to. And it's almost too simple, right? Because people are always like, well, where are the recipes? What am I counting? What am I? And it's like, no, just, stock your fridge and your freezer with animal products, grab something out of it, throw it in a pan or throw it on the grill, and you're done. And like you said, for most people, because it's such nutrient dense food, and this is another very important concept for people to understand, animal protein is the most nutrient dense food that we can eat. And when you eat that, you really don't need to eat as often. And, this is another thing that has gone wrong in our society. This concept that we need to be constantly eating. I had always put the stat out as, the average person consumes calories 8 to 9 times a day. I was actually recording another podcast earlier, and the person I was recording with said, the updated studies show that it's more like 17 to 23
Oh,
times a
jeez,
day that the
my
average
lord.
person consumes calories. And it is basically we are consuming calories, we are eating all day long. And that's another thing that breaks our metabolic health. It's not only what we're eating, it's how frequently we're eating.
Yeah, yeah, and that used to be kind of like bro science back in the day with the bodybuilding community, where there was a lot of false information about how much protein you could actually absorb in one sitting, and it seems like they've recently updated that. So it's like, no, you don't need 4 or 5 meals a day. Like you can actually hit your macros with one meal a day. You can consume 200 grams of protein in a sitting, and most of it's going to get absorbed, right? So
Yep.
that updated model should get burned into everyone's brain. You don't need to be eating 24/7. So maybe that's a good thing to talk about is why. Like, what's the downside of constantly ingesting food all the time with respect to things like insulin and mTOR and that sort of thing?
Yeah, exactly. And really, I think insulin, again, is the most important factor here. When we eat, carbohydrates most significantly, but also we need to acknowledge protein is going to raise insulin levels. Fat really does not have any measurable, effects on our insulin levels. But, each time we eat protein or carbs, our insulin level is going to go up. And on average, it takes somewhere between, 3 to 5 hours for your insulin level to return to baseline when you are metabolically unhealthy, right? This is another thing to understand. When you're metabolically healthy, it should return to baseline within about 2 hours. But when you're not, it's going to take longer. And if you're eating within that window that it hasn't returned to baseline, right now you're starting from a higher level, and you're, going to end up spiking even higher with the next dose of insulin. So that is a challenge that we need to deal with. And that compounds the problem of this high insulin. And the high insulin ultimately is very problematic.
Yeah. So why don't doctors test insulin levels? I've been to my
Um,
doctor a million times and I've had all these labs and I've never once had my fasting insulin checked.
yeah, that's a great question. And the reason they don't is just because they're not educated on it properly, right? It's not part of their standard paradigm. And they don't, understand the implications of insulin. And the important thing that I want your audience to understand so they can talk to your doctors about this is that on average, um, yeah, so eating frequently is a problem because of the insulin level. Realize that, almost everything we eat, right, both carbohydrates and protein to a lesser degree, are going to raise our insulin level. Fat really doesn't have any noticeable effect on our insulin level. And, when you're metabolically healthy, your insulin level is going to come back down to baseline within about 2 hours. But when you're not metabolically healthy, it's going to take 3 to 5 hours for that insulin level to come down. So if you're eating again 2 or 3 hours later, you're already starting now with an increased insulin level. And now you're going to get that additional spike that's going to cause your insulin to go even higher. So the frequency with which we eat becomes a very important contributor to this, ongoing and worsening problem of insulin resistance, high insulin, and poor metabolic health.
Got it. Totally makes sense. And so let's talk about some more controversial stuff. So there's a lot of different, a lot of advice out there on how to improve your metabolic health, how to make sure that your heart stays healthy, your blood vessels stay healthy. First of all, let's talk about sauna. Have you looked at the sauna studies out of Finland? And if so, like, what are your thoughts about them?
Yeah, sauna is an amazing tool for improving cardiovascular health in particular. Sauna has been shown to lower blood pressure very effectively. Comes back to a molecule we mentioned earlier, nitric oxide, that sauna can help raise levels of. Sauna is also great from a detoxification standpoint, right? We sweat, and that's one of our body's ways of detoxifying, flushing out the toxins. So there are lots of reasons why sauna is beneficial, and it's definitely a habit that I, promote. If people have access to it, definitely take advantage of it.
Yeah, fantastic. I'm a big sauna goer. I've been doing it for years before I even knew it was healthy for me. But there's a question I have, which is not just around nitric oxide, but vascular flexibility. Is that hypothesis actually a real thing? Is the constant expansion and contraction of those blood vessels healthy for your cardiovascular system?
Yes, you do want your blood vessels to be, flexible essentially, right? When they get stiff, this is again what contributes to these problems. And they can get stiff, because of the mechanical atherosclerosis issue, right, that we talked about. And you get this plaque buildup, and it interferes with the normal elasticity of the blood vessel. We talked a little bit earlier about how the blood vessel wall is made up of multiple layers, and one of those layers is sort of largely comprised of elastic tissues that are supposed to allow the blood vessel to expand and contract in reaction to different stimuli, but also when this pressure wave, right, is coming through the blood vessel, it's being able to relax some and absorb that pressure is definitely a useful and necessary feature for the health of that blood vessel. So elasticity is great. Again, nitric oxide is one of the important substances that kind of modulates that elasticity, and the loss of nitric oxide, the decrease in nitric oxide levels, is one of the main contributors to cardiovascular disease.
Got it. So do you recommend supplementing with something like beetroot powder or anything like that, or is that nonsense?
Well, so the problem is nitric oxide is a very unstable molecule, right? And it's very short lived in our bloodstream. So it's very difficult to you can't really
Mm.
directly supplement with nitric oxide. The theory behind things like beetroot and other supplements is you give your body the precursors that it needs to make nitric oxide, and this will lead to increased nitric oxide levels. And it may have some effect. But, again, more important is stop doing the damage that's interfering with your nitric oxide production, your natural nitric oxide production. Now, this can be very counterintuitive, right? Because one of the main things that may impair our ability to make nitric oxide, the majority of nitric oxide production in our body starts with our oral microbiome, the bacteria that are in our mouth. And it has now been shown that using things like mouthwashes, especially the ones that are, alcohol based, they indiscriminately kill the bacteria in our mouth, the good and the bad bacteria, and this can actually lower nitric oxide levels. So one of the things I talk to my patients about is maybe using mouthwash is not a great option. And again, it comes back to, why do we use mouthwash? We use mouthwash because we're eating these foods. The sugar is destroying our microbiome, our teeth. We're trying to counteract those negative effects. And if we just stop eating those foods, then you don't need the mouthwash. Many carnivores and low carb in general, people that avoid processed food, find that they have a reduced need, for the mouthwash. And quite frankly, even brushing your teeth, may not need to be done as often when we're not eating the food that are trying to destroy our teeth.
Yeah, yeah, totally makes sense. That's been my experience on it as well. It has been both my subjective and other people around me's subjective opinion that the bad breath, all the the plaquing, the buildup, like that just seems to have not gone away completely, but been significantly reduced when I'm on a super strict carnivore diet.
Yeah, and I think that's been the experience of many people.
Yeah, so let's talk about something else, man. So are you a Seco bro, or are you a kind of, it's more of a Jason Fung style, more hormonal balance and that type of thing? Is it all thermogenetics or is it something else?
Yeah, well, so what I say is, SECO as a scientific principle, right, is true. We can't necessarily break the laws of thermodynamics, but we have to understand that we don't have a great way of measuring either side of the equation in living human beings. The calories in is very problematic, and the calories out is even more problematic. And it's not, our bodies are not a simple thermodynamic equation. So every calorie that we take in isn't the same. And the calories, the types of calories that we're taking in, for instance, the types of food that we're eating, can affect what's happening on the calories outside of things. So, calories in, calories out is a sound scientific principle. It's just not useful for managing our weight or our health. And focusing more on the hormonal influences of the food that we're eating, I think, is a more useful tool to allow us to get to better health and to get to optimal weight.
Got it. And that's a deeply unsatisfying answer because it's nuanced and complex. People want easy answers,
Yeah,
typically. So
exactly. It doesn't play as well on social media.
yeah, but unfortunately, reality doesn't care about our opinions about it, right?
Exactly.
The mechanisms are what they are, and we just have to bow to the evidence. Which leads me to another question: is like, how the hell do we know what's true in this world anymore? I referenced, sort of lack of trust in our institutions. They've been obviously co-opted, and you've called out, the studies are terrible, right? If you actually look at studies and you know how to read them, I'm in computer science, so I have the ability to look at studies, and I've been studying this stuff on my own for a while. But it feels like, in my opinion, the average lay person will see a headline that says study finds blah, right? And they probably just read the headline. They don't read the article, and they certainly don't pull up the study and actually look at the way it was constructed, confounding variables. Is it a crossover trial? Is it epidemiological? Is it a metabolic ward? Like, that's just way too much for most people.
Yeah.
And a lot of industry is behind this, funding these studies. Like the swap meat thing that was funded by the fake meat industry, and there's so much fuckery that goes on in this space that it becomes very difficult to figure out as a layperson or even as a professional what's actually true, because we're all looking at the same literature. We're looking at meta-analysis, we're looking at individual studies, we're trying to figure out like what this tells us. Like, how do you deal with that problem? Because that's a real durable problem in my view. That's just very hard for anyone to figure out what the hell's going on.
Yeah, no, and honestly, at this point, it might be an almost insurmountable problem, right? Because there's a couple of problems with the science, the medical literature. Number one is I can probably find a study to support anything I want to, prove, because there's just you can generally find a study to support both sides of any issue. And then number two is that the medical literature has become so captured by industry that it's hard to trust almost anything that's in it anymore. So more and more, I find myself turning to the evidence in front of me, which is
Mm.
the patient, right? And what's happening with your health when you do these things. You alluded to before, any n equals one experiments may be the most informative thing we have. And when you see the pattern repeating over and over again with the patients, right? When I see the patients in front of me, that they're reversing their diabetes, they're getting off their high blood pressure medication, that their heart disease is stabilizing or getting better. Something I do see now on a regular basis, that people, for instance, have a coronary artery calcium score that goes down. That's the evidence that I'm interested in. And that's what guides me more and more. And I'm always open to the possibility of I might be wrong. I might be wrong for you in particular. I might be wrong in general. But, again, I'm seeing these patterns. They're moving in a correct direction. They're moving in the direction we want them to. And then within each individual, I'm always asking, if it's not, what do we need to re-examine? What do we need to look at? And that is more and more leading to me to what I consider success. And that success is my patient's health is getting better. They feel better. And I can see the measurements, getting better as well.
Yeah, got it. And I think that's the most important thing as a clinician, right? Is that your patients are getting better. That's but I think the contrary view would be like, oh, well, doctor, I'm sorry, you don't have the long term data. Like, yeah, I'm sure this is working in the short term, but just wait. In 20 years, your patients are gonna, dot dot dot, insert whatever negative health outcome that they're trying to scare you with.
Yeah, I mean, I have the long-term data on the other side, right? That shows me it wasn't working very well. Again, all those patients that end up on my operating table are evidence to me that the advice that we had been giving was not working, right? And this is again something that goes on sort of within the system, right? That when we have these failures, and we need to acknowledge, right? Every patient that ends up on my operating table is a failure. Not that person's failure, the medical system has failed. There is no reason that something like heart disease should get to that advanced stage before we do something about it. And so I see all of those failures, and that is part of what has led me to say we need to do something different. And yes, you're right. As a traditionally educated, cardiothoracic surgeon, the concept of eating red meat and red meat only, right, and the concept of getting off all your medications seemed crazy, but it works. And I see it working, and therefore, and I see the other thing not working. And so it would be illogical for me to say, well, keep doing that other thing that wasn't working, right? And ignore all these people that are getting success over here.
Yeah, yeah, certainly been my experience, man. It has been absolutely miraculous in my case. It's been one of the easiest health transformations, and I've struggled with my weight for a while since I had a really bad knee injury. I used to run distance and had no trouble, and yeah, it's been a durable problem for me, and that was just like instant fix for me. Like the pounds just fell off, all my metabolic markers increased or improved, and I feel 1,000 times better. And I think we're getting more and more people, like a concentrated group of folks that have got those testimonials out there, and I think it's going to be hard to ignore. And hopefully, there's going to do some long term trials around this to counteract that negative message that's out there, because I think the standard advice that we're getting from a nutrition perspective is just god awful. I mean, you look at I've had Dr. Lindy Louise on my show, and she talks about the advice around like drink Ensure. And have you ever looked at the bottle of Ensure, what the ingredients list is? It's insane. Like, I don't know how this is not criminal to give patients advice like this.
Yeah, I agree with you completely. And again, I do challenge my colleagues more and more to wake up and see, look what's going on around you, right? Our measure of success as physicians should not be that we have an unlimited supply of patients, right? It should be that the people in front of us are getting healthier. And the sad reality is that most of my colleagues, most of my doctors don't even really think that's possible. They
Mm.
no longer even think about getting patients healthy, right? It's just about managing their illness, is what we as doctors are trained to do. And we've gotten away from, that we can actually empower our patients to be healthy and ultimately to not need us, right? And this is another sort of, you know, counterintuitive and quite frankly scary things to most doctors is, what do you mean, my patient isn't going to need me? But that really should be our goal as physicians. Our patients shouldn't need us. And then on the rare occasion that they do, right, that something acute happens, now we can be more available for them.
Yeah, 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 got it. I really wish more doctors were like you, because man, like every doctor I've seen, it's very it's funny to look in retrospect at my labs, and I can watch them change year over year and go, this is a problem. I see a problem emerging, and they didn't say a word to me
Yep.
until it goes out of the band of tolerance, and slips out of tolerance, and they're gonna probably at that point be like, well, we're gonna prescribe a medication or something. There was no lifestyle advice. There was no, hey, maybe even generally even see a nutritionist. Like, there's none of that. They just sort of let things progress until they have to intervene with some sort of intervention. And that just strikes me as not a great way to care for patients.
Yeah, and unfortunately, something I see way too often. And like I said, recognize that most doctors are trapped within the system as well, and they just can't see their way out. They don't know that there's this alternative out there. So part of what I'm hoping to accomplish is get more and more of my colleagues, physician colleagues, to wake up to this as well.
How much latitude do you have as a physician, right? Because I think we all kind of know there's something called standard of care,
Yep.
that if you deviate from standard of the care, you get put in the naughty corner, right? Like, you can risk your medical license, you could risk censure, you could risk a whole bunch of different things. Is it just a situation where doctors are afraid of deviating, or is it something different? Like, I just don't understand like how much room you guys have to wiggle when you're working with patients.
Yeah, and a lot of that is perception, right? Because I am quite confident that if I ever needed to, I can defend everything I do, in a court of law, in a medical hearing, right? And I am within a community standard. And this is an advantage that we have these days, that because there are more and more physicians doing this, right, we have now created our own community standard. And thankfully, there are organizations like the Society of Metabolic Health Practitioners that are actually formalizing these standards, right? They're putting out white papers that we can now point to as clinicians and say, what I'm doing is within the standard. So, but you have to be brave enough as a physician, right, to jump, I guess, out of one standard to another. And it is scary, right? And many physicians are scared. And, one of the saddest things I see, right? You know, so many of my colleagues, right, they just don't know about this. They've never heard it. And okay, I could sort of accept that. But what's becoming less acceptable to me is the physicians who do know this and they do it for themselves, right? But they won't talk to their patients about it
Mm.
because they're scared of exactly the things that you talked about. And again, I hope that, those of us, the physician, leaders that are out there being public and vocal about this and being on social media will empower those other physicians. This is about empowering the patients and empowering the physicians. That's how we're going to, reclaim our medical system and make it work for the physicians and for the patients.
Well, kudos to you, and I hope more people stand up because I think there's been this chilling effect in the medical community. It's particularly around the global health event that happened not that long ago. Mary
Definitely
Bowden
so.
is somebody who stood up and got her license attacked and everything else, and I think she's in 200,000 in debt trying to defend herself in a court of law. It's sad to see what they do when folks actually stand up. But I think if more people did it, we would get to a better place with respect to patient care. So anyways, just kudos to you and anyone else who has the guts to do what's right for patients. That's awesome to see. Speaking of that global health event, I don't want to do all tinfoil hattie and go Alex Jones, but I'm curious, man, because I see this stuff online. You've probably seen it too, which is these morticians that are doing autopsies on people and they're finding these fibrous clots and people. Are you seeing any of that? Is that real? Is that a hoax? Is that something else? Like, do you have any insight into what that is?
It's not something I see clinically, to be honest, but it's also not something I would necessarily see clinically. What I do see is that there has been an accelerated uptick in cardiovascular disease, and especially in younger people. And yes, this metabolic health, epidemic, pandemic, is a big part of that. But there certainly was an acceleration around COVID. And, I acknowledge both the natural COVID infection, the COVID virus itself, and the COVID vaccine have known components, specifically the spike protein, that damages the cardiovascular system. And that can present in a number of different ways. And again, this is something that doctors need to be able to discuss freely without worrying that
Mm-hmm.
because we're talking about it, someone's going to be coming out after our medical license. And the way that the COVID event, the COVID pandemic, occurred within the medical system, the way that these, whatever we want to talk about, right? Whether it's the vaccines or the other treatment paradigms that were kind of thrust upon the medical system, and no one was allowed to question it, right? Doctors weren't allowed to question this novel disease that we were told, don't worry about it, we figured it out, right? And it's like, well, that has never happened before in history, right? Novel diseases occur and it takes a while to figure it out, and usually we make mistakes along the way. And not being able to question that and ask those questions should be a big wake up call to all clinicians, because quite frankly, if that is the case, right? And if it just gets figured out and here's the treatment algorithm and that's all you need to know, doctors aren't necessary, right?
Right, right.
The AI can do that stuff a lot better than we can all day long. So, it is a doctor's role to think critically, to question things. That's how medicine has evolved. Um, that's how we get innovation. I think about the field that I'm in, heart surgery, right? And understand that you don't have to go back very far. 1940s, it was absolute dogma that you could not touch the heart. You could not operate on the heart. And thankfully, there were brave physicians back then that questioned that dogma and developed, these techniques that have allowed heart surgery to progress to where it is today. But that did not come by just following the protocol. That came by experimenting and asking difficult questions and asking questions that, may not have been allowed to ask, to be asked back in those days, but they did get asked. And, that's what moves medicine forward.
Yeah, and I don't think the average person understands how it's done. I became acutely aware of this during the pandemic when, like, anyone who knows anything about medicine understands that clinicians, particularly with a novel event like that, on the front line, seeing patients that are trying things, right? They're trying different modalities to try to help patients. They're the ones who develop the standard of care, essentially. Like, they're seeing patients day in, day out, but we had it flipped. We had the bureaucracy on top, and whatever the drug companies and the NIH and the WHO were putting out in press conferences, that was a science which couldn't be questioned. Meanwhile, you had like the Frontline COVID Care Alliance and some other folks that were screaming, jumping up and down, saying like, "Look, this is what's happening. This is what we're seeing in our practice. Listen to us." And it was those people were just roundly attacked. It was sad to see, and I was very sad for my country and the world at the absolute ignorance about how medicine is actually done in the field.
Yeah, yeah, definitely so. And again, I hope that it would have woken up more of my colleagues. I think it certainly woke up a good number of them, but not quite enough for my taste. And whether it's nutrition, or COVID that we're talking about, it is the same sort of game, the same game plan that you see, and I see how it doesn't end well for any of us, and that's why we need to be challenging this.
Awesome. Want to take a hard left turn, man, and go out on the fringes. So I had a guest on my show that talking about inflammation reduction,
Uh-huh.
claims to have some emerging science around the use of ultrasound for vagus nerve stimulation. Do you know anything about that? Have you heard of anything about that?
Not really something that I've familiar with, to be honest.
Oh man, like I was hoping you would have some information because it seems, and I talked to them and I actually looked at some of the research that's out there and it appears to be maybe something to consider. And the hypothesized mechanism of action is modulating the vagus nerve, and basically that runs through everything, innervates all of your organs, including your thalamus and your spleen, and it apparently shows a reduction in C-reactive protein, IL-6, TNF alpha, and is a sort of involved in modulating the cytokine response, right? And so to me, it seemed like, wow, this is actually a really interesting area of study, and I just didn't know if you had heard of it, because I'm always looking for the next thing that's coming on the horizon.
Yeah, I mean, it sounds interesting conceptually, right? The vagus nerve, very important. And, a lot of these kind of things that I put in the biohacking, category,
Mhm.
I always point to, right? Yes, some of them have merit and they can be useful, but don't forget about the basics, right? And, when you're looking at something like inflammation, you got to ask where the inflammation is coming from, right? Because, a technique like that, great, maybe it does help reduce inflammation, just like maybe some of these pharmaceuticals help reduce inflammation. But we're always going to be better off eliminating the source of inflammation, and then we don't need those things. And so I always go back to the basics. And I think all too often, again, people are looking for the shortcuts. What can I do to not have to do those basics like eat well, right? And figure out some other way to get the same effect. And again, it's never as good as you know, the basics, and eliminate the sources of inflammation within your diet and within your environment, and then you don't have to worry about some technique or medication to try and reduce the inflammation, or even some supplement, right? These antioxidants that are always being promoted, and that's yes, they may have some benefit if you have a lot of oxidation going on, but if you eat a diet that's not oxidative, like a carnivore diet, you don't need to worry about the antioxidants.
Yeah, yeah, 100%. And honestly, that's a tough thing for people to swallow because it's not a sexy piece of advice. There's nothing on the edge. There's nothing biohacky about it. There's no easy answer. I mean, it's easy. It's just like, but you have to do, basic shit that people don't think is very interesting. But I think it's really important to not oversimplify health, right? Like we know, strength training, really, really important. Maintaining lean muscle mass, very, very important for metabolic health. As you get older, you get sarcopenia and a bunch of other things that are associated with it. Maintaining your bone density, like all this stuff, just lift exercise, lift weights, cardiovascular exercise, maybe a little sauna here and there, and take care of your fucking diet. Like it's not a very complicated formula, but I think that a lot of people hyper focus on the minutia and the cool, sexy, new, trendy thing because that is a form of not dealing with your issue. It was for me in the past. I used to watch YouTube videos about the most minuscule, thing or most obscure topic. It really was a way of avoiding just doing the basic things that I just needed to do to fix my health. And so I would encourage people, maybe keep it simple. Maybe tinker with stuff if you've got your metabolic health under control and you're at adequate weights and you're maintaining your muscle mass and your cardiovascular fitness and all these things. Then maybe add something on top of it like that. Experiment with a couple of things, but boy, not until you've got the basics down.
Yeah, definitely so.
Cool. Well, hey, that's a great place to leave it, man. Good message to end with. Thank you so much for stopping by. You're an absolute legend, and I really looked up to you. Your advice was helpful for me getting to where I'm at. So I'm going to continue to follow you, and I encourage everyone else in my audience to follow you. So why don't you tell people where they can find you?
Yeah, easy to find me. I Fix Hearts everywhere. So on all the social medias, I'm at I Fix Hearts. You can go to ifixhearts.com. You can find out about all the ways that my team and I, work with patients. And we have everything from the courses and the book to up to including the full telemedicine practice. We see patients all over the United States and even internationally. And you can find all of that over at ifixhearts.com.
Fantastic. Thanks so much for stopping by.
Thank you.